might. I do, and I miss him every day. My father loved Michael Dowling, and he's been phenomenal as a healthcare professional for this entire state, in government and out of government. And Northwell, as I'll discuss in a moment, is truly an extraordinary facility. Let me take a step back. We're at the end of the week. It's been a tumultuous week. I want to make sure everyone understands what we're doing with this coronavirus. We are trying to contain the spread of the virus. How do you contain the spread of the virus? By testing as many people as you can, find the positives, and then isolate the positive people. That's how you contain the spread of the virus. Why do we want to contain the spread of the virus? What happens if you don't contain the spread? Two things happen. First, you would have to take more drastic measures. What we have seen in China, what we're seeing in Italy, you'd have to do massive quarantine, which would be very disruptive to society and the economy. China basically closed down everything for 2 weeks. Closed restaurants, closed schools, closed businesses, closed down everything. It is massively disruptive for society, for people, and for the economy. The second consequence is the vulnerable populations here, senior citizens, people with compromised immune systems, people with underlying illnesses. This is a dangerous disease for them, for the vulnerable populations. For most people, you'd get ill, you'd recover, you'd go on with life. So those are the two reasons we are trying to contain the virus. We don't want to have to do massive close downs, massive quarantines, and we don't want members of the vulnerable population getting sick. That's why we're doing what we're doing. But there's a level of fear here that is not connected to the facts. There's more fear, more anxiety than the facts would justify, okay? That's why I want to make sure everyone understands what we're dealing with. You look at the facts here. This is not the Ebola virus. This is not the SARS virus. This is a virus that we have a lot of information on. Johns Hopkins has been tracking this coronavirus, almost every case. Johns Hopkins has been tracking the 100,000 cases. What happens? For most people, if you get the virus, you get sick, you stay home. Most people have mild symptoms. Most people don't get hospitalized. The dangerous aspect, again, people in that vulnerable population, senior citizens, the elderly, et cetera. So we are trying to contain it. I've been speaking with business leaders across the state. The private sector has a role here in helping to contain it. Basically, we want to reduce as much as possible situations creating density. So I've been saying to business leaders, first, have a liberal sick leave policy for your employees. If somebody is sick, stay home. If you feel symptoms, stay home. And I'd like the companies to communicate that to their employees, that they will pay them liberal sick leave policy to stay home. To the extent private sector companies can stagger their workers, shifts of workers. So one shift comes in early, one shift comes in late. To the extent the private sector company can say, stay at home non-essential workers. Work from home. More and more, this is a digital economy. To the extent workers can work at home, let them work at home. We want to reduce the density. Citizens have a role that they can play. Yes, wash your hands. Let's not handshake now. That great new elbow bump. Looks like it could be the beginning of a new dance move. Commissioner Zucker recommends to me every flu season that we should tell people don't shake hands. So this is not an extraordinary precaution, but it's something that citizens can do to help. If citizens are taking mass transit, if you can move to a train car that is not as dense, if you see a packed train car, let it go by, wait for the next train. Same with if you're taking a bus. It's the density, the proximity that we are trying to reduce. And private businesses can help, citizens can help in their day-to-day life. The single best thing we can do is testing. Why? Because the more you test, the more positives you identify, the more people you can isolate and stop the spread. That's why so much of this is about testing. On testing, we need more help from the federal government and the CDC. The CDC, I believe, was slow to begin with. They were not ready for this. They should have been ready for this. We saw what was happening in China. Anyone who didn't realize that someone from China was going to get on a plane and come to the United States was delusional, frankly. Second, the CDC has been slow in allowing states and other commercial laboratories to test. We were asking the CDC, which in the beginning was doing all the tests themselves, we said, let the state of New York do tests. We have a great lab called the Wadsworth Lab. Let us use Wadsworth. There was a delay in letting the states do the testing. Finally, they let the states do the testing. Now we're saying the testing capacity is more than the state lab can handle. Let us bring in private labs to help do the testing. Why? Because we want more capacity, we need more capacity. We are at Northwell Laboratories today. This is a 150,000 square feet of laboratory space, over $60 million. This is the most sophisticated lab in the state of New York. This is one of the most sophisticated labs in the United States of America. This lab has what's called automated testing, which expands exponentially the number of tests that can be done. CDC has not authorized the use of this lab, which is just outrageous and ludicrous. CDC, wake up, let the states test, let private labs test, let's increase as quickly as possible our testing capacity so we identify the positive people, so we can isolate them, and we're successful in our containment. Not to be using this laboratory, not to be using the other private labs around the state just makes no sense whatsoever. Not to be using automated testing, which means rather than a person manually handling a test tube and a test, the machines we saw that handle 120 samples at a time, place them in a machine, the machine runs the test. Of course you should be using that technology. And it's one thing for the CDC not to have the testing capacity in place themselves. That was bad enough. For the CDC not to be authorizing existing labs to do the work, there's no excuse for that. The other confusion that has been created, and I think which fuels fear in people, President of the United States says anyone who wants a test can have a test. Vice President of the United States says we don't have the testing capacity. People say, how can you say both things? You can't say both things. We don't have the testing capacity that we need. Not everyone who wants a test can have a test. We have to prioritize the people who get tests to fit our capacity, right? You can't ask more people to come in to get tested until you know you have the capacity to test them. The number of people coming in for a test must equal the number of tests you can perform. That's why in New York we have a standard protocol that's in place all across the state, prioritizing who can get tested to fit our testing capacity. Once we increase our testing capacity and we can perform more tests, then we can change the prioritization of those people coming in for the tests. We have a statewide protocol because we don't want people shopping tests. I don't want someone from Nassau driving to Suffolk, driving to Manhattan, driving to Westchester, because you have different rules on who can get a test. Everyone, everywhere in this state, it's the same rules. It doesn't matter where you go. Hopefully the CDC acts responsibly and acts quickly, and we raise the capacity. We bring a great facility like this online with the automated testing. We could then get testing per day up to about 1,000 tests, and then we can calibrate the prioritization to the capacity. As far as the ongoing testing that we're doing, we did more tests overnight, and the state now has 105 people who have tested positive. So that number is up by about 16 overnight. Westchester has 82 cases, Nassau has 5 cases, Rockland has 2, Saratoga 2, Suffolk 1, Ulster County 1, New York City 12. Obviously on those numbers, Westchester at 82 is the clear issue, and that is a warning flag for us. What happened in Westchester County is a person who was positive was in a very large gathering, and people then got infected, and then they went to very large gatherings. So that is my point about the density. An infected person in a large gathering can infect many people quickly. That's what we're seeing in Westchester. And that's why we want to avoid large gatherings. We want to avoid density. That's why I'm reaching out to the private sector companies. By the way, also local governments. I'm asking them to stagger their workforce. That's why I'm asking citizens, stay home, telecommute. When you're on public transportation, find the least dense car or bus available, because it is the density, it is the gathering. So Westchester is a particular problem. We have more work to do there. Otherwise, we're testing to find the positives. Someone said to me, well, I get nervous because the number keeps going up. I would get nervous if the number didn't go up. I want to find the positives, because we want to find the positives, because we want to put them in isolation so they're not spreading. The more positive people we find, the better. The more tests we run, the better. The more tests we run, the more positive people we will find, the better we can do the containment. So in sum, CDC, let's move, authorize the state to authorize private labs, get this most sophisticated lab in the state, one of the most sophisticated labs in the country, get this lab to work. Why you wouldn't makes absolutely no sense. And to New Yorkers, we understand the facts. Keep this in perspective. We don't want a lot of people getting this virus. We don't want to take more drastic measures. But if you get the virus, you will get sick, you will recover, you most likely won't even go to the hospital, and the only people we really have to worry about are the vulnerable population, senior citizens, people with compromised immune systems. So keep it all in perspective. I know there's a whole frenzy about it. The facts do not justify the frenzy. period. The biggest problem we have in this situation is fear, not the virus. The virus we can handle. It's the fear, and the fear is just unwarranted. Questions?
Question. So first thing is it known yet if you do contract the virus, if that makes you immune to another bout? Is that known? Also, what does the CDC or the federal government tell you why they're not letting this facility and other facilities do their testing?
They don't. I think it's bureaucracy. Why does government move slowly? I don't know, but it very often does. I don't believe it needs to. New York State government, we don't tolerate bureaucracy and the slowness of bureaucracy. We have a doctrine in New York called constructive impatience. It's not an official doctrine. It's really my own personal doctrine. Constructive impatience. I am impatient with delay. I am impatient with slowness. It doesn't have to be that way. And as a matter of fact, good government, government operating, is the exact opposite. We're mobilized quickly, and I think the CDC has just been slow off the mark, and they continue to be slow.
Governor, how many private labs are there in the state ready to do testing, and how many tests could they do a day if they were allowed to?
We have about 7 private labs that could come online immediately. What would you want to say is the total capacity for 7? Come on. 2 questions, by the way. Private lab coming on, and then the CDC also has to authorize something called automated testing, which is those machines we saw inside that can do 120 samples without a person even touching them. But the private labs and automated testing, we would be what? Over 1,000, maybe as high as 2,000 per day.
Additional or altogether?
Additional.
Governor Cuomo, Tara Jake on CBS 2. Question for you. Of the people that have tested positive, have any of them been asymptomatic?
Yes, people who have tested positive have been asymptomatic, yes.
Governor, a question about the Uber driver from Queens who drove on Long Island. Do we know how many people he may have exposed to the disease? He's driven in Nassau and Suffolk, or one of the two. And how are you going to let those people know?
We are tracking that down. On all of the tests, most of the tests we're now doing are following the investigatory tree. So you find an Uber driver, someone, you then identify who was in the car, you test those people. That's why you get the high number of positives very quickly, but that's why it's good, because you're letting those people know and you're isolating them. And we're doing that on all these cases.
Governor, you're talking about a frenzy here among a lot of people. Given that frenzy, we're seeing some cases, or at least concerns about price gouging. Are you seeing any cases of price gouging? I know yesterday you were talking about a crackdown. Are you seeing this across the country?
It's across the country, and it's in New York. The price gouging is symptomatic of the fear. Price gouging is also illegal, all right? And I've said a number of times that, first of all, any store that is price gouging now, it really is disrespectful, it's unethical, it's exploitive of people's fears, it's also illegal. And to make a few more dollars on hand sanitizer and jeopardize losing your license to do business is a fool's calculus. We have the state police doing investigations. We have a 1-800 number for people to report price gouging. The Attorney General has special power to prosecute price gouging. So any store owner that is doing this should really think twice, because they will get caught, the penalty will be severe, and it's not worth it on any level.
Do you see any possible increase in penalty as a result of this continues to
We have legal increases in penalties for price gouging.
Governor, can you clear this is one of the facilities that can and is prepared to do the testing, but will not be able to until CDC?
That is exactly right. That is exactly right. We call them daily, and we ask them for authorization of the private labs and authorization of automated testing. And I'm looking at the camera and I'm saying, please, CDC, approve these private labs and approve automated testing today. There is no reason to delay. You have misinformed the public about your testing capacity. You've caused confusion about your testing capacity. The president says one thing, the vice president says something else. We don't have the testing capacity we need. It's essential to containment. Just do the approval and do it today.
Can you or Dr. Zucker explain the protocol and the criteria for testing, which has, the CDC has changed it. New York City has talked about going beyond the CDC. Will the state follow those CDC guidelines? Who can get tested and when, or will you expand on that?
Yeah, I'm going to ask Dr. Zucker to do this, but just let's understand the format. The CDC has guidelines that frankly change from time to time. And then the President of the United States gets up and says, anybody who wants a test can have a test, which sort of trumps the CDC because he's the president. Pardon the pun on trumps. New York State has a protocol. It is a statewide protocol. Same protocol in New York City as in Nassau, as in Suffolk, as in Albany County. Why? Because we have to prioritize the tests for our capacity. CDC approves this lab, our capacity goes up today, we'll change the prioritization for the test today. But it's statewide because I don't want people getting in a car, getting in an Uber, getting in a cab, trying to go from place to find a place that has a different protocol on testing. But Doctor, why don't you take that first?
Thank you. So, sure, Howard Zucker. So anyone who's traveled to the countries that were of concern, they're going to be tested. Anyone who's been exposed to someone who is positive will be tested. Anyone who's in a hospital where you can't find out any other cause of their infection or what's happening to them, we have a routine panel that we look at for other viruses and bacteria. They would be tested. And then if you work with your healthcare professional and there's a concern, obviously be tested. We have all these on the website. We could share that for you.
So, yeah, because as you said, the CDC's been changing it, but this is what's giving people a lot of confusion. But it sounds like there's some flexibility in what a doctor can do if they feel like the patient deserves.
Well, we want the physicians and nurse practitioners nurses to be able to use that good clinical judgment to decide who needs to be used, who needs to be tested.
Governor, you mentioned a gathering in Westchester. Can you tell us what that was, when it happened, time, date?
They had a number of gatherings at a temple in Westchester and the synagogue, and there were a large number, hundreds of people. And there were then a series of the gatherings, and it spread a little bit more, spread a little bit more.
One more, guys. Are you doing off topic at all?
Sure.
All right. So you were on Fox.
Are you doing off topic?
Absolutely. Whatever you say, Governor.
So as we were rushing to get here, apparently on Fox News, you said that you believe President Trump is afraid of facing Joe Biden. Is this true, and why do you think that, and can you elaborate?
This is true. I believe Donald Trump is afraid of facing Joe Biden by what Donald Trump did, right? You look back at this whole Ukraine situation, Rudy Giuliani is a very busy man. Why was he running around the Ukraine trying to dig up dirt on Joe Biden? The president is a very busy man. Why was he talking to foreign leaders about possibly investigating Joe Biden? Why did the name Joe Biden come out of the president's mouth? It doesn't come out of his mouth unless he's afraid of Joe Biden. He wasn't asking about Bernie Sanders. He wasn't asking about Amy Klobuchar. He didn't ask about anyone else. He wanted Joe Biden out of the race. Why? Because he's afraid of Joe Biden.
Sir, you didn't ask the question I asked first, which was, is it known yet whether if you are infected and you get well, are you then immunized against further getting it again?
Sure. So one time will tell on that because we're so early in the process here. But the normal immune response works that way, that if you get an infection, you have viruses, you get infection, your body will make a response, you won't get it again.
Thank you, guys.
Thank you all very much. Thank you. And thank Northwell very much for their hospitality today. Thank you.